Dr. Mammen, good to have you and welcome.
Thank you. Thank you for having me.
So, I've enjoyed doing these, and I have to say I enjoy it because I get a chance to learn about some of the things that really inspire our faculty and the things that kind of led you to be, what you are. And we have amazing faculty at the University of Pittsburgh, and everybody comes from different backgrounds and a lot of different education, and all very impressive. But along your training and along the things that you've done to get to this spot, at some point you had an inspiration that said, "I'd like to get into medicine." If you could share with us that path and what led you to decide this is what I want to do.
All right. So in the upbringing that I had quite a bit of exposure to medicine. So I was born in India, southern India, and both my parents are physicians. So my dad practiced as an ophthalmologist. My mom was a dermatologist in India. She worked with the leprosy mission there. And quite a few of my family members are in medicine. So in a way, I couldn't get away from being exposed to medicine. I recall when I was younger, my dad used to go away every few months for a few days as part of these ophthalmology camps that he would do cataract surgery in. So peripherally, it was certainly in the back of my mind, medicine, and specifically ophthalmology. And I saw it on a daily basis, the practice of medicine. I would go visit my mom in the clinic, see patients that she was treating. And so it was certainly a daily part of my childhood. But that being said, I knew that I wanted to be in a field of science. I was always fascinated with science. I knew I wanted to be in a field where I could make a difference. And so we'll hear that a lot, and it's become sort of cliche, for those who pursue medicine. They want to do something good. They want to make a difference in the lives of others. And that certainly was an important factor in my decision-making. And the opportunity to be involved with an area that I was already naturally interested in was certainly made the decision easier. Certainly my parents, they were biased, because they were in the field of medicine already, as far as what their recommendations were for our careers. So I have two siblings. I have a younger sister who's also in medicine. She's a pediatrician. But my brother, he was the black sheep, so to say. He wasn't particularly interested in pursuing the field, and it wasn't something that my parents necessarily forced upon us. But to answer that question in a long-winded way, so a combination of factors, but certainly a heavy influence from family, but also an innate interest in doing something that was constructive and had a lasting effect.
Well, it's kind of neat when I've talked to the faculty that are really second generation in the field, how the perspective is very different. There's an appreciation for the way things used to be, and then there's an appreciation for how things are really developing and changing. And you're really involved in a lot of very, very cool things. I read on your introduction that you're the medical director of the Charles T. Campbell Lab. And we actually interviewed Reej Kowalski on here just recently. So that's a great spot. It's a really unique asset for the department. But from a physician's perspective, how important is it to have that asset, that microbiology lab that's there for you and for your patients?
Yeah, I mean, certainly we as clinicians, and specifically as cornea faculty, we're spoiled. we don't realize, how privileged we are to be in a department that has an ophthalmic microbiology laboratory. And the numbers are dwindling, the number of ophthalmic microbiology laboratories, for many reasons. Part of has to do with economics, a lot probably has to do with the economics of sustaining a laboratory, but we're certainly blessed to have this opportunity to work with individuals like Reach, who really have that passion for microbiology and really exude that enthusiasm for sharing knowledge. So not only are we able to utilize it to treat our patients better, so we have the opportunity, for example, to get information from cultures that we may take very quickly, and that can influence the decision about medical management of these patients. So not only can we do that, but we also have the opportunity to teach using the resources of the laboratory, as well as to learn. So to do the research that Rich Kowalski is very well known for, internationally known for. And it's really a crown jewel of the department, and I'm so blessed to be able to be a part of the team.
So I know you take a very active role as well in doing a lot of the education and training of our surgeons in training and the residents. Is that something that you've always gravitated to, and why you stayed in academic medicine? Is that?
Yeah, I mean, I knew early on, so I knew a couple things early on. I knew I wanted to do medicine, as a child. Really, there wasn't anything else that drew my interest to the same degree that medicine did. There's nothing that is more valuable than our health. That's the other cliche, but that we take for granted until something goes wrong. So I knew I wanted to be involved in medicine, but I also knew that I wanted to be involved in academics. So teaching and academia, that's the other vein that runs quite strongly in the family tree. And so my grandfather, for example, was a high school teacher. So he used to teach English and history. I have quite a few professors in the family in different subject areas. And as I mentioned earlier, many people in medicine. So I knew I wanted to teach. I knew I wanted to be in academics. Part of the reason is I enjoy being able to share what I've learned and the mistakes that I've learned, and help to make sure that others don't necessarily have to make those same mistakes again, to be able to pass it on. Because I've had great mentors, great teachers, and it's really gratifying to be able to pass on that knowledge to the next generation, as well as to our peers, and help them also, better take care of their patients.
So you've been, you've been, how many years have you been here? I'm trying to
So I came in 2011 for fellowship.
Okay, so yeah, because you were here just a little bit after I came. All right, and you stayed after fellowship.
Right. That wasn't certainly my intention, coming from Georgia. My plan was to return to somewhere in the Southeast, but this grows on you, and it grows on you quickly. Pittsburgh, great city. I love sports, so you can't beat the opportunities you have here to partake in sports, to be part of the black and gold enthusiasm, and it doesn't help, and it doesn't hurt rather that we win. We have quite a few championships, so having the Penguins and the Steelers win, it makes it easier to jump onto those bandwagons. But certainly the sports, the academia, it's a great academic city, great academic institutions, and as well as within the department, I saw opportunities to be involved in the education side of things, and having the microbiology lab made the decision to stay so much easier.
Oh, very good. Now, there's been, you've, like I have, and the rest of those have been, here for since before Dr. Sahel came, and there's been we've all seen a lot of growth, some changes, some some things that really are going to increase the size and the depth of what we do, both clinically and in research. How can this help you and affect you in the future with your goals and what you do want to do in medicine?
Yeah, I mean, so one of those things that drew me into to being able to stay here was the opportunity to be involved both on the education side as well as the clinical and research sides. So the opportunities that Dr. Sahel has brought with the New Vision Institute are only going to be able to help us do those missions, fulfill those missions even better. So he's really committed to making sure that the microbiology laboratory continues to thrive. He's focused on patient-centered care. So, we hear about physician burnout, and UPMC has really, made it one of their missions to help physicians in that respect. And Dr. Sahel takes that mission seriously. And he's also committed to making sure that we as faculty are given the tools that we need in order to be able to better treat our patients, better teach our residents, our fellows, our medical students. So all of this is moving in the right direction.
It's really encouraging to hear. And I know that, the Campbell Lab is just a hotbed for research. There's so much opportunity there, and there's so many, and it's been that way for years. And I know that a lot of our residents in training who've really gotten excited about research have started their projects there and had a chance to do that. So, and I do know that in talking to Dr. Sahel, that was one of the bright spots that he felt that Pittsburgh offered too, in terms of, as an asset for care. So do you see that growing or expanding with maybe some of the things in our new facility in terms of what we can do, or are there any, or will there be any changes that will be, that will impact the Charles T. Campbell Lab?
Yeah, I mean, so we've had the influx of new faculty, as you mentioned, and they've brought new perspectives. We've had some international faculty, so having those perspectives, including the international perspective, in ways it's easier to do things outside the US for many reasons, with less regulation. So they're ahead of us in certain respects. So having that perspective of quote unquote advanced care in some ways is beneficial to us. As far as the Campbell Lab, yeah, I mean, it's been beneficial to have the input of new faculty like Vishal Janji or Gaurav Prakash, and including Dr. Sahel. The perspectives that he's provided with the direction of the lab have been influential in shaping the direction that we're going to go. I mean, we have a legacy that we need to uphold with the Campbell Lab, as you've alluded to. And so we take that responsibility seriously. And with the next generation of educators and researchers and clinicians, we intend to utilize the new resources that we have, the commitment we have from the institution and from our chairman, to make sure that we continue to not only maintain the legacy, but continue to expand that legacy so that we make the most of this, the resources that we're given.
Well, that one sounds exciting, but also, I'm glad to hear that that is the plan, and that it's ultimately, going to continue to grow and continue to get integrated along with many other things that are happening within the department. And I'm so glad that I had a chance to learn about this from you today. It's been very nice to catch up with you, and it's very nice to kind of get a chance to talk about these areas of interest of yours.
Well, thank you. Thank you for the time.
And well, thank you. And You have a wonderful day.
Thank you.